Have you ever wondered what really changes once you cross 75? Most people think aging is only about wrinkles or slower movement, but the truth goes much deeper. The body starts sending subtle signals, shifts in energy, appetite, memory, and even emotions, long before we notice them. You may find yourself feeling tired more often, forgetting small things, or struggling to do activities that once felt easy. These changes don't happen overnight. They build quietly over the years, until one day, you realize your body and mind simply don't respond the same way. But here's the thing. Understanding why these things happen can make all the difference. Once you know what's going on inside your body, you can take real steps to stay strong, alert, and independent for much longer. In today's video, we're diving into 5 changes that happen once you turn 75. Whether you like it or not, these are not myths or general ideas. They're real biological shifts that almost every person experiences. But don't worry, we'll also talk about how to manage them so you can age with control and confidence. Before we start, I'd love to know how old you are right now and what changes you've personally noticed over the years. Share your thoughts in the comments below. Your story might help someone else feel less alone in this journey. And if you find this video helpful, don't forget to hit that subscribe button so you never miss our next discussion on health and aging. Number 1. Muscle loss and frailty. After 75, losing muscle becomes a constant unless you fight it. Muscle fibers shrink, strength drops, and everyday tasks that once felt easy, standing from a chair, climbing stairs, carrying groceries, start taking more effort. The medical name is sarcopenia, and it's not just about appearance. Muscle powers balance, protects bones, helps keep blood sugar steady, and supports breathing. When muscle declines, everything that relies on it becomes harder. You may find yourself tiring faster, moving slower, and avoiding activities you used to enjoy. This leads to a cycle. Less activity causes more muscle loss, which causes less activity, and so on. The result can be a noticeable change in how independent you feel. Nutrition matters more than most people expect. Protein needs rise slightly with age because the body becomes less efficient at building new muscle. Many older adults eat less overall, skip protein at breakfast, or prefer soft, processed foods that are low in real protein. Without enough protein distributed through the day, the body cannot repair and rebuild muscle well. Calories matter too. Unintentional weight loss is common after 75, and while losing fat might seem fine, losing muscle is the real risk. Resistance work is the single most effective counter. Lifting weights, using resistance bands, or even doing bodyweight exercises 2 to 3 times a week stimulates muscle growth and preserves strength. It does not require a gym membership. Simple, consistent routines at home can make a big difference. Balance and power are part of the picture. Slow walking won't cut it alone. Short bursts of effort, step-ups, sit-to-stand exercises, and controlled stair work build the speed that prevents trips and falls. Recovery matters more than in younger years. Older muscles need more time to rest between sessions, and older adults should pay attention to soreness and energy levels. Hydration and sleep help muscles recover. Supplements may help, but are not a substitute for real food and movement. Vitamin D and adequate protein intake are common targets, but talk to a clinician before starting any pills. The practical risk is clear. Weak muscles increase the chance of falls, and falls are a major cause of hospital visits and loss of independence. Strength work lowers that risk more than many other interventions. If you or someone you care for has already cut back on activity, start small. 2 short sessions each week are better than none. Add a little more over weeks and months. Progress is slow but meaningful. More strength, steadier walking, easier daily tasks, and a greater ability to live on your own. In short, concluding muscle loss is not a fixed fate. It's a predictable change that responds to a predictable set of actions. Move with purpose, eat enough protein, and let the body recover. Number 2. Slower thinking and memory shifts. After 75, changes in thinking and memory are common. The pace of processing information often slows. Word finding becomes harder. Short-term memory, like remembering a name or a recent conversation, can slip more than it did in earlier years. For many, these shifts are mild and do not stop everyday life. For others, the changes become more serious. Distinguishing normal age-related change from a problem that needs attention matters. Normal change usually feels gradual and does not erase a person's history or identity. Problematic decline often affects daily tasks, safety, and the ability to manage money or medications. The brain does change with age. Connections between neurons weaken, and some regions shrink a little. That makes multitasking harder and learning new complex skills slower. But the brain can adapt. Mental activity keeps it sharper. Reading, social interaction, learning new things, and mentally demanding hobbies help preserve skills. Routine matters. Good sleep, regular activity, stable blood pressure, healthy blood sugar, and avoiding heavy drinking protect thinking. Hearing loss and sleep apnea are often overlooked causes of apparent memory problems. When some sounds are missed or sleep is fragmented, the brain performs worse during waking hours. Treating hearing loss or improving sleep can produce clear boosts in memory and focus. Small daily habits add up. Keeping a calendar, using notes, and following simple routines reduce errors and stress. Social contact is also protective. Isolation increases the risk of more rapid decline. Emotional health matters. Untreated depression often looks like memory loss. Medical review is important if memory loss affects routine tasks. Several treatable conditions, low thyroid, vitamin deficiencies, medication side effects, infections, and metabolic issues can cause or worsen confusion. Regular checkups and honest conversations with doctors and family help spot problems early. For those worried about dementia, testing and planning matter. Early diagnosis creates time to treat reversible contributors, set up supports, and handle legal and financial choices while judgment is still good. In short, thinking may slow and memory may shift after 75, but proactive habits, medical care, and social engagement keep the mind functioning better than many expect. Don't accept decline as inevitable. Treat it as a signal to act. Number 3, bone loss and higher fracture risk. Bones become less dense with age, and after 75, that decline often accelerates. The structural scaffolding inside bones thins, making them more brittle. This is why small falls that once caused bruises now cause fractures. Hips, wrists, and vertebrae are common sites. A broken hip in an older adult is not a minor event. Recovery is long, complications are frequent, and the chance of returning to previous independence drops sharply after major fractures. Prevention focuses on 3 fronts: bone health, fall prevention, and safe living environments. Bone health depends on consistent building blocks, dietary calcium, vitamin D, protein, and regular weight-bearing activity. Many older adults do not get enough vitamin D, either from sunlight or diet, and low vitamin D reduces calcium absorption and worsens balance. Bone density tests are a reasonable check after 75, especially following a fracture or if risk factors exist. If a test shows weakness, medication can slow or reverse bone loss. These treatments work best when combined with good nutrition and exercise. Fall prevention is equally important. Home hazards, rugs, poor lighting, slippery floors, and lack of railings are common contributors. Simple changes make a large difference. Remove loose rugs, add night lights, install grab bars in bathrooms, and choose stable chairs with armrests. Footwear matters. Non-slip, supportive shoes lower the risk of slipping. Vision checks and medication reviews reduce risk too. Many older adults take drugs that lower blood pressure or make them dizzy. A clinician can adjust doses or swap medications to lower fall risk. Balance and strength training help more than many realize. Programs that include standing balance practice, step work, and controlled strength moves improve stability and reduce falls. Even short sessions several times a week add up. For those living alone, technology can help. Alerts, emergency response services, and simple check-in routines reduce the time between a fall and help arriving. In short, bones weaken after 75, but fractures are largely preventable. Assess bone health, remove fall risks in the home, review medications, and keep moving with strength and balance work. Number 4, sensing the world differently. Vision, hearing, and taste. After 75, your senses change in ways that affect daily life. Vision dimness, glare trouble, trouble reading small print, and narrower visual fields are common. Cataracts, macular changes, and glaucoma become more likely. Hearing loss also increases. Quiet speech, background noise, and phone conversations become harder to follow. Taste and smell often dull too, which affects appetite and nutrition. These sensory shifts do more than annoy. They alter safety and social life. Difficulty hearing leads many to withdraw from conversations, avoid gatherings, and feel lonely. Trouble seeing can make driving riskier, reduce reading and hobby time, and increase fall risk. Because these changes happen gradually, people and families may not notice how much function is lost until problems accumulate. The fix is straightforward. Get checked. Regular eye exams and hearing tests catch treatable issues early. Cataracts are common, and surgery is safe and effective. New lenses restore clarity and reduce glare. Glaucoma and macular disease require medical follow-up and treatment to protect remaining vision. Hearing aids are not what they used to be. Modern devices are smaller, clearer, and better at separating speech from background noise. Many insurance plans and suppliers offer fitting services and trials. Better hearing improves mood and memory and reduces isolation. Practical changes help in daily life. Larger print books, brighter task lighting, phone settings that increase font size, and simple home modifications like better contrast on steps and controls. For taste loss, focus on bold, varied textures and nutrient-dense foods to keep appetite up. If weight drops, seek help quickly. In short, senses change after 75, but many solutions restore function and safety. Seek tests and treatments early and adapt daily life so you stay connected and nourished. Number 5. Medication sensitivity and multiple health issues. By 75, many people take several medications. That mix creates a real challenge. Interactions, side effects, and changing effects as the body processes drugs more slowly. Kidneys and liver, the main organs that clear drugs, work less efficiently with age. The same dose that was fine at 60 may produce dizziness, confusion, or falls at 80. Polypharmacy, taking many drugs, raises the risk of errors, harmful interactions, and symptoms that mimic other illnesses. For example, a blood pressure pill may cause low blood pressure and fainting. A sleep aid can worsen balance and thinking. Some painkillers can cause constipation, which then leads to other problems. The key is regular, honest medication reviews with a clinician or pharmacist. Bring a full list of prescriptions, over-the-counter drugs, and supplements to appointments. Ask which drugs are still needed, which can be reduced, and which may interact. Deprescribing, carefully stopping medicines that are no longer helpful, is an important tool. Monitoring matters too. Labs that check kidney and liver function help guide safe dosing. Start low and go slow when adding new medications. A lower dose often gives the right balance of benefit and fewer side effects. Non-drug approaches are worth trying where possible. Pain, insomnia, anxiety, and some urinary issues may respond to therapy, exercise, sleep habit changes, or other measures that reduce reliance on pills. Finally, coordination matters. Different specialists may prescribe without full visibility of the whole picture. A primary care clinician or geriatric specialist can act as a hub to manage medications and overall health goals. In short, after 75, medication sensitivity and multiple conditions are common but manageable. Regular review, careful dosing, and trying non-drug options protect function and reduce harm. If you learned something new today, please give this video a like and share it with someone who's also navigating this stage of life. Don't forget to subscribe and tell us in the comments which of these 5 changes you've noticed most. Your experience matters here.